Hi friends, welcome to Smile Nursing Tutorial. Today we are going to see the differences between the true labor pains and false labor pains. In this true labor pains, the pains begins irregularly but becomes regular and predictable. Next, felt first in the lower back and sweeps around to the abdomen. Next, continuous no matter what the woman's level of activity, increases in duration, frequency, and intensity. Next, accompanied by show, blood-stained mucus discharge. Next, cervical effacement and cervical dilatation. So, above all, we will see in the true labor pains. Next, false labor pains. The pains begins irregularly and remains irregular. Felt first abdominally and remains confined to the abdomen and groin. Often disappears with ambulation or sleep. Does not increase in duration, frequency or intensity with the passage of time. Next, so is absent. Next, does not achieve any cervical effacement and cervical dilatation. So, today we have seen true labor pains and false labor pains. Thank you for watching this video. Next, we'll meet with another video.